My next guest, Roy Lilley, is a former NHS Trust Chairman. We're going to... good morning to you, Roy.
Good morning, Julia.
Apologies for that. We've had a bit of a ruck about migrant policy, as I'm sure you were hearing.
I was watching. Now, I want you to be gentle with me.
Never with you, never with you. You know you can handle it. I want you to tell us a little bit about this policy announcement from Keir Starmer unveiling this virtual hospital service. A, what is it? And B, will it actually change our lives at all?
What it is that some of the dialogues that you would go to hospital have, like, for example, let's say you've had a hip operation and then you go to the outpatient's appointment post-operatively and you take your day off work, you spend a fortune to park your car, you traipse through the outpatient's department, you sit there, it's running late for 3 hours, you get called in and they say, "Oh, Mr. Lilley, how's your hip? Fine. Any pain? No. You sleeping all right? Yes, fine. Let's have a look at the wound. Yes, terrific. Thanks very much. Come back in 3 months." You Brilliant. Can do that with a selfie on the phone.
Yeah.
So it's that chunk of what we call the care pathway, which they will carve out and put on the phone. A bit like GPs now. A third of all GP appointments now are done on the phone, and people love it because, as I say, they don't have to go to the surgery and be coughed all over and take time. So it's very popular. I mean, they're talking about saving 8 million appointments or creating 8 million appointments. Well, I mean, that's 8 million dialogues people have got to have. The surgeon who carried out the operation, not necessarily the specialist, could be a registrar.
But when you say 8 million, again, what percentage of the number of appointments there are? Because aren't there hundreds and hundreds of millions of appointments?
There are, Julia, and I don't understand. I've read and reread the press release in as much as that I've got the bit that Starmer's. I know what he's going to say. It makes no sense to me, and so perhaps there's more context in it when he reads it.
That's a bit of a worry. I mean, it does sound a little bit like, we're a first world country entering the 21st century, that you can do things online. I mean, a lot of that's been online anyway. As you said, lots of us just... And do I really need to go into the GP to have this very short conversation, or can I just frankly write an email?
I think very good.
Prefer that.
There are other bits as well. They want to try and get people to make their own appointments. And then actually in the 10-year plan, the NHS 10, which has just come out, they're talking about people self-referring to and that's not a great idea.
I think that's definitely better, because we know we've got the worried well. We've got people who just permanently want to either a GP appointment or NHS consultant, and NHS consultants therefore not being available to see people. I mean,
I think what's going to happen. There's going to be a waiting list for online NHS someday.
Yeah.
You just, at the end of the day, the more capacity you create, the more it fills up. So what you've got to do is to try and cut the demand, stop people getting sick in the first place, focus on the community, social care. Yeah. The two big users of the NHS are the over 65s and the under 9s. Both of those say to me, community nurses, district nurses, better GP access. So
a lot of the unsexy stuff, which actually is the stuff that really does make a difference to people's lives. That's the really tragic thing.
Health visitors. I mean, we don't have enough health visitors, but they're hugely useful for mums and not sure what to do and what have you. So
and they pick up on problems very, very early.
Absolutely.
Well, again, here's an idea. Maybe if we didn't lock the country down for a couple of years and basically turn off the NHS for 6 months to pretty much everybody who didn't have COVID, maybe wouldn't be in quite the mess we're in. But what do you make of the criticism? Well, I know they're going to bring it up in Wes Street, and the Health Secretary is speaking, saying, Nigel Farage is coming for the people who make the NHS. He said he was a snake oil salesman and a con artist, and talking about how basically how they're going to I think the Prime Minister is going to say that basically a Farage-run health service would check your pockets before your pulse. But hasn't he just been calling for there to be change to the NHS to bring it into line with pretty much every other Western country's insurance-based health system, where people don't have waiting lists and get very good service?
Yeah, I mean, there's a complicated answer to that, but he has, Farage, as far as I've followed him, has had a number of iterations of what his policy is. He's gone from having a straight, outright insurance-based system through to carrying on with the system that he is now. Of course, immigration policy would hit the NHS. People not earning 60,000 a year are going to be turfed out. Well, that's goodbye to a lot of nurses and things like that. So, I mean, I don't know where it sits on that. Tell you what really surprises me.
Very quickly, yes.
Yeah, is the extent to which the Labour Party keep mentioning Farage. He's had free adverts.
Yeah, absolutely. They've not been very good at their own communication skills, I think we can safely say. They've got more to say about reform than what they're going to do. Roy Lilley, thank you very much. I'm so sorry it was so short, but given that you can't really make head or tail of this policy, perhaps we didn't need longer.